Recording. Okay, this is Lisa Majeski. I am the owner of Gold Star Medical Business Services, and we're going to be presenting a webinar on privacy and security concerns for the medical practice, dealing mainly with Hipaa. And so this is going to be a special webinar for Amberwood Terrace Chiropractic. We'll be using this as a training tool for them, ongoing training for new employees and their existing employees as well. So let's go ahead and get started. We're really just going to be talking about the main elements and procedures relating to Hipaa that are going to be most applicable to a chiropractic practice. And so just by way of a backstory as far as what Hipaa is, Hipaa stands for the Health Insurance the Health Information Portability Act. And this was actually passed, Hipaa was passed initially in 1996. And so the intent of Hipaa was pretty much threefold at that time. One was provide insurance portability for patients, meaning implementing systems that would allow patients to easily move their records from one provider to another, promote simplifications or consistent standards for billing transactions, and then prevent fraud and abuse of the healthcare system. Now, some of you may be too young to even know this or remember this, but in 1996, we didn't have cell phones, and we didn't have, email wasn't being used, and certainly there was no electronic medical records, except for maybe some hospitals had electronic, documentation systems. But really and truly, in 1996, everything was still on paper, and so the main focus of Hipaa in 1996 was to protect patient charts and to protect patient information from being sold to outside entities. For example, doctors, used to routinely sell their patient lists for a fee to pharmaceutical companies or to medical device companies for money, and then those medical device or pharmaceutical companies would market their products to that doctor's patients. And so Hipaa did away with all of that, made that illegal. And then, of course, there was also a lot of discussion in the early days of Hipaa about securing patient charts, just making sure that patient charts weren't lying around in the treatment rooms where other patients could see, and so on and so forth. And of course, if you were around during that time, there were huge scares about Hipaa. People didn't know if sign-in sheets were allowed. People didn't know if therapy bays would be allowed, or if you had to have individual therapy rooms or individual adjusting rooms for patients. Physical therapy clinics were all up in arms, of course, because everything is wide open in physical therapy clinics, and of course it's easy to overhear conversations between providers and patients about their health and so on and so forth. And so, over the first few years of Hipaa, a lot of clarification was made, and it was determined that things like sign-in sheets and open adjusting areas or open treatment areas were perfectly fine, and there's several reasons for that, and we'll be discussing those today. But over the years, Hipaa had to morph, and the reason why is because of the prevalence of the electronic medical record, and then of course of the prevalence of electronic communication of patient health information or protected health information, which is also known as PHI. And so in this course, we're going to focus on an overview of some of the recent legislation. Now, when I say recent, it's about 10 years old now, followed by a deeper explanation of Hipaa and the issues that have resulted from its implementation. So again, the original Hipaa privacy regulation was enacted in 1996 and then finally published as law into law on the Federal Register in December of 2000. The original document is over 1,500 pages long, and so I always joke that it makes really good bathroom reading, but it's not something that you as a healthcare clinic would really need to delve into. There's just some really main points in HIPAA that we need to make sure that you are aware of. So after 2000, one of the things that really significantly changed the HIPAA law was the 2008 American Recovery and Reinvestment Act. And this, of course, if you think back a little bit to when that happened, that this was when we were in a severe recession. And so there was a push to have a big recovery of the American economy. And as part of that recovery, they looked at healthcare spending and healthcare waste. And one of the things that they realized was that there was a lot of waste and extraneous spending in healthcare due to the fact that the standardization of electronic transaction sets were not consistent throughout the United States and consistent through the insurance companies and through the hospitals and so on and so forth. So one of the provisions within ERA, it was this sub-act called HITECH. And HITECH stands for Health Information Technology Act of 2009. So it is the HITECH Act of 2009 that significantly changed some of the original HIPAA provisions, or not necessarily changed them, but really added to them and enhanced them. The other thing that the HITECH Act did was it made HIPAA enforceable on audit. So when you go back to the original HIPAA law, HIPAA was only enforceable on a complaint. So, for example, if a patient felt like their HIPAA, their patient health information was disclosed, unauthorizedly disclosed, or there was a HIPAA violation, then that patient could complain to the OIG, and then they would investigate. But they wouldn't just investigate by, doing a random audit. However, in 2009, that changed. What it did was it gave the state Secretary of State's audit authority for updates on HIPAA. And so now the attorney generals of the individual states can actually do random HIPAA audits to your practice. So the bottom line is you could actually be audited at any time. Now, I am going to say that because of the enormous job that would be for even the state secretary generals to get out there and audit all of these healthcare clinics, you're not going to get audited probably unless there is some kind of a red flag in your HIPAA procedures and your policies and your systems. I'm not going to say it could never happen. I mean, it could be that there's a lottery system and you could just be chosen for a random audit, but the likelihood of audit is low unless you have a patient that makes a complaint, or something happens like your medical records get hijacked, and then an investigation definitely needs to be launched in a situation like that. So as far as the enforcement of it, you're probably in okay shape, but that still doesn't mean that, you don't want to be non-compliant when it comes to HIPAA. So the first thing I wanted to talk to you about is something called breach notification. And so there's always this question about if there is a HIPAA violation in our practice, or if there's a suspected HIPAA violation in our practice, at what point do we need to notify the patient that there may have been a breach in their patient health information or in their PHI? So, and then you have to identify whether the breach was an electronic breach, okay, or whether it was a physical breach, such as their health records were viewed unauthorized or something like that. And so there's sort of a general rule of thumb as far as what a breach is. And so a breach is defined in Hipaa as the unauthorized acquisition, access, use, or disclosure of PHI. So the following would not be considered a breach. Number one, where an authorized person who receives the health information cannot reasonably have been able to retain it. So, for example, all of you are authorized to view a patient's health information, PHI. Okay, so you are an authorized person. You receive that health information, and I mean, you will be in a patient's account, and they have a policy number. Okay, and once you log out of that patient's account, you're not going to remember that policy number unless you write it down somewhere and you take it with you. Okay, so it's reasonable that you're not going to retain that information in your mind, even though you see it. Okay. Now, if an unintentional acquisition, access, or use occurs within the scope of employment or a professional relationship and the information doesn't go any further, that's not considered a breach. So, for example, one of the things that you have to understand with respect to PHI is that it's all on a need-to-know basis. So, using that as an example, the doctor's notes. So, who in your office would really need to see Dr. Hendricks' documentation about a patient encounter? Okay, would the front desk need to see that? Probably not. Maybe the biller would need to see it because maybe the notes are being requested by an insurance company, and so they have to get to the notes, and so that would be authorized, right? But let's say the front desk person really has no reason to see a patient note, but unintentionally they get into that part of the software and they see the patient's narrative. That's an unintentional acquisition, okay? And it's not going to go any further. It's not like they're going to read the note and then go out and tell somebody out in the community what they read, okay? The information does not go any further. And then the last one, and this is usually the most common one, is the inadvertent disclosure that occurs within a facility and the information does not go any further. So I'll use, this is a perfect example. So Dr. Hendricks is in the hall talking to his therapist about a patient's treatment plan, okay? And he says, I want you to give Maura 10 minutes of E-stim, and I want you to do a deep tissue massage on in the left trap area for about 10 minutes. And another patient walks by as you're saying this, okay? That is an inadvertent disclosure of PHI, verbal disclosure. But the patient is probably not going to pay attention to that, and the information is not really going to go any further than the conversation that was had in the practice. Okay. Now, there is always a danger of a patient overhearing something, and maybe that patient knows the other patient that you're talking about, and then goes out and tells somebody else about it. It's usually it's pretty unlikely in a chiropractic clinic that this would really be a big issue. But like, for example, in a medical clinic, let's say a doctor is talking to a nurse about a patient's, they've just been diagnosed with, stage 4 colon cancer. Okay. And then a friend of that patient walks by, and it happens in small towns. This kind of stuff can happen. A patient walks by and they overhear it, and they go out to their ladies' prayer group at church and says, I just heard that so and so in our church has cancer. Let's add her to the prayer list. Okay, so it's very, very well-meaning, but it is still at that point in time that is a disclosable breach because that person overheard something in the clinic, about a patient's PHI, not theirs. They went out and told somebody else out in the community, and now it's out there. And so that would be considered a disclosable breach. Once, if that patient that, asked her friend, well, how did you know? I didn't tell anybody that I had stage 4 cancer yet. And that person said, well, I overheard it at the doctor's office, then they could file a complaint against you. Whether they would or not, is probably not, but, they could file a complaint. And so those are you need to understand what a breach is. And a breach can be verbal, it can be written, or it can be electronic. So be aware of that when we're discussing breaches. One of the other things that ERA did is that it strengthened the right of the patient to restrict disclosures. And so, for example, a patient is allowed to restrict disclosures of PHI to other people, to other doctors, and now under the new ERA law and the HITECH Act of 2009, to a health plan. And so this is very significant for doctors who are in network with an insurance company like Blue Cross Blue Shield, okay? And I know that you guys are only in network with Medicare, so this does not apply to Medicare, but this applies to other health plans like Blue Cross Blue Shield. And so what this means is that, let's say you were in network with Blue Cross Blue Shield, and a patient has a high deductible, and you offer them the opportunity to pay cash for that service. Technically, because you're a network, you have to file the patient's insurance. Your contract states that you have to file the patient's insurance, but if the patient says, I'm restricting disclosure of PHI to that Blue Cross health plan, they would then sign a waiver to file insurance and agree to pay 100% out of pocket for those services. Then at that point, that overrides your managed care contract. And so this is how you can get by as an in-network provider with not having to bill insurance on a patient with a high deductible by advising that they can restrict the disclosure in writing with a waiver to file insurance. And then if they ever decide to go ahead and file their insurance, let's say later on in the year they meet their deductible, then they can go ahead and revoke that waiver, okay? And so the other thing that the other provision in ERA and in the HITECH Act was it gave more guidance on what was considered the minimum necessary. And so minimum necessary is an important concept in Hipaa because what it is talking about is what is the minimum necessary amount of PHI that an employee in your organization needs in order to do their business. So, for example, we're a billing company, and we're considered, as a billing company and as a training organization, we're considered business associates with you. You're a covered plan, you're a covered entity, and we're a business associate. Minimum necessary applies to us as well. And so let's say you were using us for the billing operations in your practice, or you have a biller in your practice. The question is does your biller need access to certain areas of your practice management software in order for them to do their jobs? And so if you look at the different areas of practice management software, what would they need to have access to? Would they need to have access to the doctor's notes? And the answer is probably yes, because, again, they may need those notes to send along with a claim. But would the front desk need it? No. The minimum necessary would state that really the front desk doesn't ever need to see the doctor's notes. Okay. Now, they would need the appointment book, but would the massage therapist need the appointment book? And so those are the questions that you have to answer on minimum necessary, and then that would guide you as to, when a person logs into your practice management software, which parts of the software would they have access to, and which parts of the software would they be restricted from? Okay, so minimum necessary standard. Okay. One of the other things that ERA changed is that covered entities using electronic health records may no longer exempt disclosures for treatment, payment, and healthcare operations. So if there are electronic breaches in your practice management software, or you email somebody about a patient and it goes over just regular email and there is a breach, then you now have to disclose that to the patient. Let them know that there was a breach in their PHI, but you only have to go back 3 years. Okay, so you don't have to go back, farther than 3 years. Okay, and if there are inadvertent disclosures or unauthorized disclosures between the covered entity, which is you, and the business associate, and we're going to talk a little bit about what business associates are right now, because you have people in your office right now that are business associates, or maybe. And if a business associate obtains unauthorized access to PHI, you would have to disclose that to the patient. So I'm going to give you an example in your clinic of what a business associate would be. A business associate might be your janitorial service. So if you have a service that comes in after hours and cleans the practice, and let's say, for example, you left out some patient charts, or you had a referral form, and instead of shredding it, you just balled it up and threw it in the trash, and now the janitorial service has access to that, okay? And something happens, and that PHI gets out of the clinic. It went further than the confines of the clinic due to some unscrupulous, janitorial worker who gains access to your software, but because you left your software running, at the end of the day, and they were able to get in and get patient account information and things like that and use it for identity theft, then that would be a disclosure of a business associate that you would include in your accounting report that you develop for your patients, as far as what disclosures happened to that patient's PHI. Of course, this has always been in place and in force in Hipaa, and that is the prohibition on the sale of PHI. And so ERA prohibits the direct or indirect receipt in exchange for an individual's PHI without an authorization from that individual. The other instances that we have with ERA, individuals now have the right to request electronic access of an EHR record. So if you're using EHR, you as a covered entity must, on request, must provide the individual with an electronic copy of their PHI, which means that you're technically supposed to have a patient portal to where that can be securely, that electronic paperwork can be securely transferred over to the patient, okay? And you need to make sure that if you're using patient information, PHI, for marketing communications, that you are getting very specific written authorization for that marketing communication from the patient. So if a covered entity is paid by an outside entity to send a communication to the patient, it's deemed to be marketing and requires prior authorization from the patient. Okay, so that kind of talks a little bit about disclosure in general, but what is PHI? Okay, and so you have to know whether what you are disclosing or what you are working with is considered PHI that would then be considered as a breach. So the first thing you need to know is what is known as individual identifiable health information, or IIHI, okay? And there are 19 elements of IIHI that would be considered to be PHI, that if, and the rule of thumb is if more than one of these elements are disclosed in the same encounter, in the same conversation, then it is considered a breach, okay? So IIHI is considered to be so if it's created or received by a provider, health plan, employer, or clearinghouse, relates to past, present, or future physical or mental health care or the condition of an individual, information that somehow identifies the individual, or with respect to which there's a reasonable basis to believe the information can be used to identify the individual, okay? And these are your identifiers, okay? So the name of the patient. And notice that it's not the last name, first name, it's the full name. So the patient's full name is considered one of the 19 identifiers. Geographic subdivision smaller than a state, all elements of dates, all ages over 89, and elements of dates indicative of such an age, telephone numbers, fax numbers, email addresses, etc. Medical record numbers apply, mean like a patient account number, okay? Health plan beneficiary numbers are the patient subscriber IDs, account numbers, vehicle identifiers, device identifiers, URLs, and so on and so forth, okay? All of these are considered elements of IIHI, okay? So the bottom line is, let's say, for example, you were to email each other using just like a regular Google account, okay? Not an internal email system. And so you email each other and you say, hey, Maura emails Dr. Hendricks and says, Dr. Hendricks, can you please update the notes on Jane Smith regarding her, for the date of service of such and such a thing, so I can get the notes sent out to the insurance company, okay? So because you've disclosed in that email her name, okay, and the date of service, all elements of dates, meaning dates of service, then you have disclosed two elements of IIHI, and that means that you have a breach because you sent it through an unsecured email system. And so that be aware of that when you are in communication, this also deals with, and I'm getting a little bit ahead of myself, but this also deals with texting. If you're not texting through some type of a secure texting app or secure encryption app, and you're texting each other back and forth, and you're disclosing more than one of these IIHI elements in the same text, it's considered to be a breach, okay? Patient rights with respect to their PHI and IIHI is that they have the right to review this and request corrections to any errors in their IIHI. And a covered entity providing direct treatment to a patient will be required to provide that patient with a notice of privacy practice, outline in that notice how their health information will be used, attempt to obtain written acknowledgement of the receipt of privacy notice, and note that you don't have to get written acknowledgement of that, but you have to attempt to obtain written acknowledgement of that. Explain the patient's rights to review and request corrections, explain their right to limit or restrict disclosure, and explain their right to that they have a right to an accounting of disclosures of the breach of PHI if it was to happen. Okay, so under the modifications of the standards in 2009, there used to be a requirement for mandatory written consent, and that has now been revised under the modifications to the standards. At this point in time, you are only required to make a good faith effort to obtain the patient's written acknowledgement of the receipt of the notice of privacy policy. So if you have a notice of privacy policy and you give it to the patient, you would ask them, here is a notice of your privacy policy. And at the bottom of the notice, there should be a place for the patient to sign it. My recommendation would be every new patient, you give it to them, you just tell them, go ahead and read through this and sign at the bottom, okay? Now, the patient can refuse to sign, and you can't make them sign it. But at that point, you can notate at the bottom of the notice, patient refused to sign, and, offered to patient refused to sign, and you're fine. Even though a patient's signature is not required, it is preferred, because if you don't get the signature, then somehow you have to document that you made a good faith effort to give the patient that notice of privacy practice. Okay? And if you have any questions about any of this, again, feel free to type it into the chat box, or we will open this up for questions at the end of the presentation. Okay, so some of the things that need to be in your privacy notice, first of all, it should state very clearly, this notice describes how medical information about you may be used and disclosed, and how you can get access to this information. Please review it carefully. This should actually be the first sentence of your privacy notice. One of the things that if you want to do, you can send a copy of your privacy notice to me, and I will take a look at it and let you know. I also have standardized copies of privacy notices that if you just want to, let's get an updated one that we know is compliant, I will go ahead and get it to you, and it can be customized for your practice, okay? It should be written in a simple language and prominently posted. So what that means as far as prominently posted is some doctors take their notice of privacy practice, frame it, and put it up in the reception area. Some have it in their hallway. Some have one in each treatment room, and so on and so forth. If you do get a notice of privacy practice, that notice has to be retained for a minimum of 6 years and be provided to the patient at their first encounter. And make sure that you verbally notify the patient that they have the right to see and copy medical records and request amendments or corrections to their medical records. Okay, so there's a big difference between privacy versus authorization, okay? For the use of information not in the treatment, payment, or healthcare operations, a valid patient authorization has to be obtained, okay? So what do we mean by that? Under privacy is with respect to the treatment of the patient and the PHI that is being used for the day-to-day business of your practice. But sometimes PHI or IIHI needs to be disclosed outside of the practice, and a really good example of this would be for marketing. So, for example, the patient does a patient testimonial, okay? Even though they are verbally doing the testimonial and they have signed the testimonial, you need to get a separate authorization that they are allowing that testimonial to be used for information that is not involving the treatment, payment, or healthcare operation. Okay, it's being used for marketing purposes. And so just having a signed testimonial is not good enough, because if you take that testimonial and let's say you put that testimonial on your website and you don't have specific authorization for that testimonial to be used on your website, then the patient can consider that a violation and do a complaint against you for a violation of PHI. Okay. The patient or responsible party can revoke that authorization at any time. And in the instance where state laws are stricter or of a higher level of protection, they will take precedence. You would have to check with a healthcare attorney for sure, but I do believe that the only states in which state law is stricter are Florida, New York, and California. I don't think Indiana is, but you may want to just double check on that. Okay, so what about parents who are representative or minors? Okay, so parents can receive PHI of minors, and it is ruled in part by state law. So, for example, if a minor, let's say the minor is a teenager and they have self-emancipated, in that case, because they are, even though they are underage, but they're self-emancipated, you cannot disclose to the parents if the minor prohibits it. Okay? Also, there are other healthcare specialties in which minor children may restrict or prohibit a parent from receiving PHI. And that's in the case of a very, very common one is in the case if a minor patient seeks out birth control from an OB-GYN or is pregnant or is asking, trying to go and get an abortion, there are actually, most states have laws protecting those minors from having to disclose that to their parents. Okay? If there is not a prohibition in your particular case, then a parent can agree to allow confidential information between the physician and minor, but they would have to do that in writing. And you usually see this commonly in mental health. So, for example, a child is being counseled for, some type of a trauma that they've had, or they're receiving counseling for overacting or acting out in school or something like that. And the child, the counselor feels like the child is not going to open up to them unless they know that what they're telling them is going to be kept confidential, even from the parent. And so then at that point, the counselor would go to the parent and say, your child has some things that they want to tell me, but they won't talk to me if they think that I will talk to you about it. So do you give consent for us to have a confidential conversation? And then the parent would have to make that approval. So the covered entity, and also the other element of accounting is the non-routine disclosures. So the covered entity, which is you, must act on an individual's request for an accounting no later than 60 days after receipt of such a request. So what is a non-routine disclosure? A non-routine disclosure would be the individual just asking you for if there was any kind of a disclosure, and if so, they want to see it, and you have to provide that to them within 60 days. Okay, so I told you we would talk about business associates a little bit, and you as a covered entity will probably work with business associates throughout your practice, and in various formats. And so these include, but are not limited to, billing services, independent contractors, transcription services, vendors or suppliers, collection agencies. So if you send patient to collections, for example, do you have a business associate agreement with that collection agency? Because if you don't, then you are disclosing PHI without authorization. Make sure you have a business associate agreement. Temporary personnel services, hardware, software vendors. So like your IT people, you should have a business associate agreement with them, because they are getting into your computers and having access to PHI. Maintenance companies that remotely service your equipment. So for example, if you lease your copy machine, and they come in once a month to change out the toner, especially if those copy machines have memory on them, and they come in, or they come in after hours, and they could potentially have access to PHI. you need to make sure you have a business associate agreement with them, okay? And so on and so forth. So this is a fairly complete list of business associates, but there may be others that are not on this list. And if you ever have a question about an entity as to whether they would be considered a business associate, you can always contact me about that. What are your training requirements? So a covered entity must train all members of its workforce. So to each member of the covered entity's workforce by no later than the compliance date for the covered entity. And so for you, your compliance date is now. You should be in compliance right now. So all of your workforce needs to be adequately trained and on at least an annual basis on HIPAA and HIPAA updates. And so that should be happening immediately, which it is. This is our you're meeting that requirement right now through this training. Thereafter, to each new member of the workforce within a reasonable period of time after the person joins the covered entity's workforce. And the HIPAA law doesn't specify a hard number, but they do recommend 90 days. So within 90 days of hire, you should have a new employee attend HIPAA training. Okay, and so if you want to, what you can do is you can go ahead and I will make sure that you have a link to this training video, and then you can have them sit down and watch this video. Okay. If there is any material change in your practice policies, then you need to retrain your workforce. So, for example, if you change software, okay, or if you move all of your records from paper records to electronic records, anything where there's a material change in your policy that could affect HIPAA, you need to retrain. So let's look at just some examples of what privacy violations would be that could be considered a disclosable violation. So someone leaving, this is one of the more common ones, someone leaving their desk with their computer screen visible with PHI on it or IIHI. And again, you know, it may be that you're in an office where only your coworkers may actually see that, but under the minimum necessary law, it still could be considered a violation if the information you have up on your screen goes beyond the minimum necessary information that person would need to see. So be aware of that. The nurse calling in a prescription, obviously you don't have that here. A patient sign-in sheet that requests the reason for seeing the physician. So, for example, you can have a sign-in sheet, but you can't have a sign-in sheet that says, why are you here? The reason for the visit, because now there's two elements of IIHI. Remember, one element of IIHI is the patient name, and so a sign-in sheet is recommended, and in many cases it's necessary because unless you're having a patient electronically sign in, like with Cairo Touch, for example, if you're using the iPads to have the patient sign in, then you don't need a sign-in sheet because they're electronically signing in. But if you don't have an electronic sign-in, then you should have a sign-in sheet, because that's the only legal proof you have that the patient was actually seen that day. Even if the doctor produced a note and you posted a charge for that day, that the patient could contend, well, I wasn't seen that day. And so the only way that you can prove that would be to go to the sign-in sheet or go to the electronic signature of the patient and say, well, you did an electronic signature on this day that proves you were here, or here's your signature on the sign-in sheet, okay? PHI, IIHI left on desks or discarded where janitorial staff or others can view it. Discussion with family members that the patient has not authorized. You have to be very careful about this, especially in a small town. Let's say, for example, a patient, a person calls up, and this is really common. A kid calls up and says, "Yeah, I need to find out if my mom is here. I just got home from school. My mom's not home, and there's a note that says she was going to see you, but she's not home yet. Is she still there?" The question is if the patient did not authorize that you disclose that information to the child or to other family members, something as innocuous as that could be considered a disclosable breach. Okay? Email or internet, and again, discussion with family members, in a chiropractic office, it's husband and, let's say, a lot of times you have families that come in together, right, for their adjustments and so on and so forth. And so, the wife is being adjusted by Dr. Hendricks, the husband is in having therapy, and the therapist inadvertently says, well, your wife is really doing a whole lot better with her, with her neck problem, and it seems like she's doing her exercises. Then the husband tells the wife what you said, and she says, well, I never gave them permission to talk about it, I mean, is that going to happen? Probably not, but if it does, it is considered a breach. So you have to be very careful about discussing another family member's health information with them unless that person is there, okay? So like if, let's say the husband and the wife are in the therapy room together and they're talking about their back problems or their neck problems or how much Dr. Hendricks has helped them, and they're all there and you as the therapist are talking to them about it, that is not a violation because that is implied consent. They wouldn't be talking about it in front of each other unless they approved, okay? So while they wouldn't have to do written consent in a situation like that, that is implied consent. Same thing where if the patient is in the treatment room with their family member and their family member is watching the treatment and Dr. Hendricks is treating the patient, it's a good idea to ask the patient, are you okay with your husband being in the room with you? Are you okay with your wife being in the room with you? And if they say it's okay, then you don't have to get written authorization for that. Other privacy violations would be, again, email and the internet, unsecured, like just plain old Google, Gmail accounts or Yahoo accounts, and you're emailing back and forth with those accounts. Those are non-secured emails, and those are very, very common violations that really need to be cleaned up if that's something you're doing. Fax machines that are in locations accessible to unauthorized persons, and so on and so forth. And so phone messages, again, left with coworkers or other answering machines. Now, one of the things that was defined in the Hipaa was that if the patient gives you a cell phone number and you do a reminder call on their cell phone, it is not a violation because that cell phone is their own private phone. It's not like a landline phone that might have an answering machine that other people can hear. Okay, so be aware of that as far as reminder calls go. Okay, there are times when you can release PHI or IIHI without patient authorization. That would be in emergencies, to identify deceased or cause of death, in the instance of public health issues, research under specified guidelines with patient authorizations like clinical trials, healthcare system oversight, judicial and administrative proceedings, any requirements under law enforcement like a subpoena or a court order that is ordering you to turn over PHI or medical records, and then requirements for national defense and security. Those are the instances in which you can release PHI without the patient's authorization. Okay. Electronic media, let's talk about that. Electronic media, again, was addressed in the updated version of Hipaa, what we call the post-2009 version. And electronic media is a mode of electronic transmission including EDI, which is electronic data interchange, and this is where you are filing claims electronically between your software program and a clearinghouse, or your software program and your clinic and an insurance company. Okay. So under the security standard, so HIPAA now has two standards after the error law and the high-tech rule. They have the privacy standard, which we just talked about, but now we're looking at the second part of HIPAA, which is the security standard. And the security standard relates to electronic PHI or ePHI. So covered entities, which again, you are a covered entity, must ensure the confidentiality, integrity, and availability of all ePHI that you create, receive, maintain, or transmit. Okay? Identify and protect against reasonably anticipated threats to the security or integrity of the information. Protect against reasonably anticipated impermissible uses or disclosures, and ensure compliance by your workforce. So let's talk about this. One of the things that you should do with respect to HIPAA security is a risk analysis of your practice's ePHI. So number one is know where your ePHI is stored, received, maintained, or transmitted. So for example, you have ChiroTouch. So your database is stored on a server, okay? It is transmitted to the claims would be transmitted to such and such a clearinghouse. Do you have like any type of shared record system like a Google Doc, for example? Well, if you do, then that Google Doc is maintained on the cloud. And if so, is it adequately protected? Where is it being received? Okay. Evaluate the likelihood and impact of potential risks to ePHI. So, for example, in your risk analysis, if you guys are texting each other back and forth about patients all day long and you're not using an encrypted system, that is a high likelihood of a risk of ePHI being captured or hacked. Okay. Implement appropriate security measures to address the risks identified in the risk analysis. So if you do a risk analysis and you feel that there are areas within your HIPAA security that is at high risk for a possible hack or capture or stealing of ePHI or disclosure of ePHI, not only do you document that, you document what security measures you're taking to close that risk up, okay? And then maintain continuous, reasonable, and appropriate security protections. So, and these security policies and procedures should be maintained until 6 years after the later of the date of their creation or last effective date. Security policies and procedures and written records of any required actions that you had to take to protect and shore up your ePHI. Since there is a relationship between the privacy rule and the final security standards rule, it is important that you examine both your privacy policies and compare them to the final security standards. Okay, so the HIPAA privacy rule establishes a set of national standards for the use and disclosure of IIHI. Okay, and it establishes national standards to protect individuals' ePHI that is created, received, used, or maintained by a covered entity. And then these safeguards, when applied well, can help you avoid some of the common security gaps that can lead to a cyber attack or data loss. Okay, so the security standards require covered providers to implement measures which help protect patients' privacy by creating the conditions for PHI to be available but not improperly used or disclosed. Okay, Um, of note, there have been a number of security incidents related to the use of laptops and other portable and/or mobile devices, such as PDA smartphones, public wireless internet systems like hotel libraries or other public workstations, wireless access points, USB flash drives and memory cards, CDs, DVDs, backup media, email, smart cards, and remote access devices. So, for example, Dr. Hendricks, I'll just use you as an example. Let's say you are traveling and you're wanting to get into your Chiro Touch program remotely from the hotel that you're at, to catch up on some notes, to catch up on some doctor's notes. And you have a way to remotely log in, that's fine. You can have go to my PC or have remote desktop connection or something like that to remotely log in. But if you remotely log in from the hotel's wireless internet, which is unsecured, that's a breach. Okay, so what you would need to do is you would, like what I do, for example, because I have to work from hotels a lot, is I use my telephone's wireless mobile hotspot, which is securely protected, and has high password and high encryption. And I use my computer with my mobile device, with my cell phone's hotspot. And most of the time what I do is I hardwire it in, or I tether it in to my computer so that I'm not using the hotel internet. And I mean, for those of you kind of FYI, if you're ever using a hotel's Wi-Fi, don't ever get on your banking, don't ever get on anything that could put you at risk for a hacker. That is a place where hackers love to live, in those areas, and many of them will have tie-ins and malware on these hotel internet services to be able to try to hack into the guests' information. So just kind of be aware of that, not just for patient information, but for your own protection as well. In general, covered entities should be extremely cautious about allowing the offsite use of or access to EPHI. So make sure that you put a significant emphasis and attention on your risk analysis and risk management strategies. Make sure you have policies and procedures for safeguarding EPHI, and make sure that everyone has a security awareness. You really need to have that as a culture in your practice, that everybody is highly vigilant and aware of the security measures that need to be taken. Okay. So some of the best practices for small healthcare environments to protect your EPHI, use strong passwords and change them regularly. So one of the things is, for example, in your Chiro Touch program, every one of you should have your own login and password to Chiro Touch. This way, there is an audit trail. If there is a breach of EPHI, the breach will be identified by the user. And so if you're sharing user IDs or you're sharing usernames and passwords, that is one of the most common security breaches out there. Okay. Same thing if you have access to provider portals in which you log in to get copies of patient EOBs, or you do eligibility checks through a provider portal like Anthem, Blue Cross Blue Shield, or Availity, or your Medicare portal. You have to make sure that everyone that has access has their own login, their own password, and that those passwords are strong and are changed regularly. Nowadays, most of these portals will only allow you to use the same password for a short period of time before you're required to change them. And most of them now require multi-factor authentication, meaning you need a login, a password, and then they even send a secondary password, like to your cell phone, where you have to key it in and it's only good for one time. Other security measures: install and maintain antivirus software. Make sure you use a good firewall. Control access to PHI, remember, on a need-to-know basis, and control physical access to PHI as well. Limit network access. So, make sure that if you do have computers that are networked together, that you limit that network access to only computers that need to have that PHI on it. Plan for the unexpected. So, what would the unexpected be? The unexpected might be, for example, you have a terrible storm, and the terrible storm fries your hard drive. And now, all of a sudden, your ChiroTouch program is kaput, it's fried. What have you done to ensure the backup and the restoration of that information? Plan for the unexpected. Maintain good computer habits. So what are good computer habits? If you're at your desk and you leave your desk for any length of time, log off the system, or at least blank out the screen. Protect your mobile devices. My cell phone, for example, has fingerprint identification. So, and my mobile device will stay on for a total of 5 minutes before it hibernates, and then I have to use my fingerprint to turn it back on. And of course, because I do business with clinics, all the time, I have to be very careful about my mobile device and the security of my mobile device. Establish a security culture in your practice. Education and training must be frequent and ongoing. Make sure those who manage and direct the work of others must set a good example and resist the temptation to indulge in exceptionalism. In other words, we don't make exceptions, for the doctor, or we don't make exceptions in certain situations. Accountability and taking responsibility for information safety must be amongst your organization's core values. And so this is something you want to instill in all new employees, and you need to make sure that you have this instilled in everyone who's currently working for the practice. Okay. One of the biggest issues with EPHI are cyber attacks. Medical identity theft is one of the highest and fastest growing white-collar crimes in the United States. And it's because providers, covered entities, especially on the provider side, are very lackadaisical with their computers and with their passwords and password protectors. And so what computer hackers do is they will hack into your computer, place a malware virus on your computer, and then the next time you try to log in to your system, you get a pop-up that says your computer has been attacked and kidnapped, and you, in order to receive the key, the security key to unlock your computer, you have to pay a ransom. And God's honest truth, this is happening. And it's even happening in small practices. Okay? I mean, sometimes you see those hospital shows on TV, and they have, episodes that are dedicated to the whole hospital system being hacked. It is far less likely for a hospital system to be hacked than a private practice, because a private practice is so much easier to get into. Okay, and so the value of health information is high, and it's not just a matter of if a data breach will take place, but in many cases when. Okay, first, if you pay the ransom, okay, and you get your medical your programs back, you're still going to have to notify every single one of your patients that there was a hack. And if it involves more than 500 patients, you have to do it publicly, meaning you have to do it in the newspaper or in some kind of a public forum in your community and in communities around you, okay? And so, that the hackers, when they hack in, they get access to the PHI, which means that you had a massive data breach. And so you might get it back, but you'd still have to disclose that breach to the public, and you would have to do it in a public way if it's over 500 people involved or 500 records involved. If you don't pay the ransom, then your computers could be wiped, and if you don't have a good backup system, you could lose years and years of patient data. So again, this is a very real problem, and please don't think that it can't happen to you, because we have actually personally been involved in two clients of ours who have had a cyber attack on their systems from actually patients who were computer geeks that were able to hack into their systems. And in both cases, it was patients wanting to change their accounts to where they wouldn't have a balance on their accounts, and they knew how to hack in, and they did. And so, but what ended up happening is that if that patient gets into their file, they can get into everybody's file, and so that those data breaches had to be disclosed publicly through the newspaper and through the internet. And so we talked about the what ransomware is, and again, it is usually not recommended that you pay the ransom. What you should do normally is just not pay the ransom, and then you would they would give up and they would unlock it, but you would still have to disclose that the computer was hacked, or you not pay it, they wipe your system, but you have good backups, and so you can restore everything. So be aware of that, because if you do pay the ransom, a lot of times the hackers will go back in and demand a second ransom to unlock the files. Okay. So some of the security measures that you need to take. Let me see how we're doing on time here. Okay. We'll talk a few more minutes, and then I'll open it up. We'll talk until 2 o'clock, and then we'll open it up for some questions that you might have. So HIPAA requires the following security measures. Number one, a security management process, which includes conducting a risk analysis to identify threats and vulnerabilities. I recommend that you outsource this. Have an IT person come in and take a look at your HIPAA security measures on your computers and help you do a risk analysis. This isn't something that you want to do homegrown, okay? You want a professional to do this, and make sure that when they give you a report, that they do the report in writing so that you can add it to your compliance manual, and then you can add the remediating steps that you took to identify those risks. Implementing procedures to guard against and detect malicious software. That should be written up in your policy and procedure manual. Training users on malicious software protection so that they can assist in detecting malicious software and know how to report such detections. One of the most common ways for malicious software to be introduced into your practice's computers is through the use of social media on your practice's computers, through the use of your staff or yourself opening up your private email accounts that are not the office's email accounts, and to open up emails called phishing emails, okay? You have to be very, very careful that when you get an email and that email contains a link and you don't really know who that email came from, or it just seems a little suspicious, don't ever open up an attachment or a link, because what that does is that it introduces a worm into your computer that allows hackers to get in, okay? Implementing access controls to limit access to ePHI to only those persons or software programs requiring access. The most important things to prevent possible cyber attacks from your for your employees is to thoroughly train all of your employees who use a computer as part of their job to recognize the signs of a possible hacking attempt. Homeland Security recommends never clicking on any links in emails unless you know who it's come from. Clicking on a malicious link could result getting caught in a phishing scam or having patient information otherwise compromised. This occurs when a person clicks on a malicious link in their email that then downloads a program that steals information. If you recognize the sender, go to the website directly to log on. You should also never click on an email attachment, even if it's from a recognized sender. Make sure that passwords are changed regularly and are difficult to guess. So this would be an example of a phishing email, okay? And this may come from, a lot of times these hackers will hack and capture the logos of popular companies like Google, Facebook, PayPal, and it looks like the email is coming from Google or Facebook or PayPal, but when you hover over the email address itself, it's not even close, okay? And what it'll say is something like this, go ahead and follow this link to fill in the copyright law form. And it threatens that if you don't do this, your account will be permanently blocked, okay? And then also you may see spelling errors or grammar errors on the email. Be aware, all of those are examples of a possible phishing email that you should just then completely delete or put into your spam folder or your protected, just your discard folder, okay? And then we'll just finish up with this, sample patient confidentiality guidelines for staff training. Only access the information you need as a staff to perform your specific job duties. Never access patient information on any patient that you are not directly involved with, or have a need to know. And never share computer passwords or codes with others. Never leave your area with protected health information exposed. Never access patient information for other people unless they are in the need to know position only. And if you are asked by coworkers or other staff for confidential information and it's not obvious why they need it, then ask them, why do you need this information and do you need it for your job? Okay? If you're asked for information or for confirmation of confidential information, these are some helpful responses. For example, we talked about a few of those examples of a kid calling in to find out if their mom is there, or a wife calling in to find out when their husband's next appointment is. If there's no authorization, then you can say these things. I'm sorry, I can't release that information. I'm not allowed to provide that confidential information, et cetera, et cetera. So these are just some things that you can do to help protect the security and privacy of your practice. So I'm going to finish up now with this, and we will, I'm going to end the recording right now. And again, you can use this recording for future training. Once I finish the recording, then I'm going to unmute everybody for questions that you might have. I'm going to finish the recording right now.